All right, well, let's get started with Friday Facts. We are already starting conversations with Dylan Bondy, who I'm really excited to have on the Friday Facts because I've spent some time with Dylan and he has great previous experience, great current experience, great fun side hustle, which we've already been talking about that you're going to have to share with everyone. So Dylan is a man of many hats and experiences. And so let me first say, welcome to Friday Facts, everyone. A big thank you for those real quick announcements that joined the Joining Our Voices Symposium. The recordings are up, 3 great sessions. They were really well attended. So please go ahead and listen. Plan to join us December 13th. We're going to have Karen Seagraves on, and Dr. Seagraves does all kinds of innovation in the healthcare space like Dylan. So it'll be really neat. I feel like we're continuing on from the AI and tech session when we're learning about new cool things happening. And then we have our end of the year meeting on December 20th. No Friday Facts at the end of December. So Dylan, you are our second to last one for the end of the year. But let's get started. Dylan Bondy, Head of Outreach for Solace. Welcome.
Thank you so much. Yeah, really excited to chat, and always good to see you, Heather.
So I know, great to see you. And we've met a few different places. We first met at the Orange County Wellness Fair, since we're both in Orange County, or we're near the area, both of us. And then we started seeing each other at other events. And then you joined the coalition. Thank you. So I wanted to say this is one of our new member get to know each other sessions. I was thinking about how to start this. I really want to dive into your background because I think your progression is so interesting. And we have this history here, Friday Facts, of really trying to spend time getting to know folks. But I do think we should do, if you don't mind doing one sentence on what Solace is, so that way as they hear your progression, they know kind of where, because some groups people have a sense of what it is, but Solace is going to be brand new. So the quick top line of what Solace is, and then we're going to learn a little bit more about you.
Sure. Yeah. So Solace provides individuals on Medicare access to independent patient advocates that are covered by their insurance to help them unlock the most that their healthcare plan can offer, essentially.
Okay. All right. We're going to put a pin in that because we're going to get back. So now folks know it's the navigation and advocacy for Medicare beneficiaries. That's wonderful. Dylan, though, you have a really interesting career trajectory. Tell us kind of your background. Where are you from and what got you interested in health advocacy?
Yeah. So yeah, a little bit from all over the place, but I'm originally from California. Um, and I kind of started in the space of really public service before even going to college, right? I did AmeriCorps city year in South Los Angeles, and that kind of prompted when going to college, getting very involved in food justice. Kind of saw the disparity between this school in central Iowa. I went to Grinnell College, really small liberal arts school with a lot of endowment per student, very high endowment per student. And meanwhile, like 1 in 6 folks, 1 in 7 were food insecure in the greater community. And so kind of seeing that stark contrast on top of having spent a year doing, service in a middle school in South LA, it was kind of like, there's something's got to give here. And so I, got involved with Food Recovery Network, started a program that was recovering excess food and getting it to people in need in central Iowa, with the help of a big team of students. Fortunately, that food recovery program is still going today. And from there, ended up getting involved in imperfect produce, which ultimately turned into Imperfect Foods. I was one of the first employees over there. That company was purchased in the last couple of years by Misfits Market, right? So kind of took that food justice experience, went kind of started doing something in the sustainability and kind of the direct to consumer space, stayed in direct to consumer food. But in the last couple years in particular, I had been really hungry to um, do something that again that everybody really needs and everyone can access, because I certainly did really love doing the work at Imperfect. um, but at the end of the day, everybody needs access to good healthcare. And I was very fortunate that one of the founders of Solace actually was my former boss at Imperfect. And when he was starting up Solace, and I'd kind of known the backstory behind it from the get-go, I was really interested. I've personally seen loved ones act as family caregivers and really be overburdened by um, a system that really is not built to support them or the person that they're supporting. um, and so to hear that folks could access an advocate who could actually help alleviate a lot of the administrative strain, help get folks access to really everything they should have access to when we think about like the ideals surrounding American healthcare. um that was something I was really excited about. So I'm really lucky to be working with Solace, and I've been here um since March doing uh outreach, so kind of the more direct in-person stuff.
Mhm. Well, thank you for sharing that, and I'm so excited that Karen Appert is joining us, who also works in the food justice space and farmers market and food distribution and support around the state, and so that's such a perfect linkage there. So tell us how Solace works. How do people? Who are the advocates? Who are the navigators? How do people get linked up?
Yeah, absolutely. So Solace kind of functions as the like central platform where it's all happening, right? So there we have doctors and advocates on our platform, where an individual on Medicare, or a loved one power of attorney can go on our site, see if they qualify. And the vast majority of people on a Medicare or Medicare Advantage plan do qualify. Takes about a minute on solace.health. And from there, they can set an appointment with one of our supervising intake physicians. And so that physician um, will get to know that individual and kind of what they're dealing with, try and get kind of as expansive a view as they can get. So that way, based on that information, we can pair them with the right advocate. Our advocates are typically retired doctors and nurses, hospital administrators, case managers, but depending on what the unique needs are of the individual, we will try and pair them up with the best fit. For example, one of the specialties that we tend to work with a lot, and one of the reasons we were really founded in the first place, um, was in response to uh, navigating the really, I mean, just an incredibly difficult journey of a cancer diagnosis, and then uh, treatment and everything that goes with it. And so, if somebody comes to us with a recent cancer diagnosis, we might try to pair them with, a retired oncologist who's on our platform, who can then kind of help really shepherd them through the process. And again, all of that is then covered actually uncapped by Medicare. So CMS regulations that were enacted at the beginning of this year, January 1st, 24, provide for uncapped advocacy hours.
So I'm glad that you shared that because I have two. I was going to ask that second, but let's go into that, and then I'll go back to my other question. So in terms of CMS, let's geek out for a second because I know this audience will appreciate that.
Mhm.
Because how do you bill? And that's where you're getting. Tell us about that ability to. Let's talk about codes for a second. How this is actually paid for.
Yes, and so I can speak in a general sense, in that we have
General
some
is great.
who are much more experienced with with handling the actual codes. But what I can say is that E&M codes are really what allow for advocates, or us to be able to bill for advocacy, and advocates must be supervised by a physician, right? So hence why we have our intake physicians. When we place someone with an advocate, the advocate will have an introductory call with that individual and put together a care plan. That care plan will then go back to the physician for feedback and ultimately approval, and then ongoing supervision. And so it is um, uh, essentially like supervised by the doctor, right? So that is a key piece of it.
So, and I kind of want to guess what E and M stands for. Is that like education and monitoring or E
Um,
and M codes? Okay, but
I always use the acronym.
oh,
So
that's
evaluation and management, I believe, is what it is.
okay. That would see. I shouldn't have even guessed. Evaluation management. So these are actual clinical codes, and so that's how you're able to get reimbursed, which is why Medicare and Medicare Advantage. So, and which is
Mhm.
why it's got to be providers. The question I was going to ask to help explain to the group, you keep using a really interesting word, and that is platform.
Uh-huh.
Solace is a platform. So
Mm.
tell us about that because these are not inpatient. And this kind of goes into our recent conversations about technology and new innovations. So tell us about the word platform and what that means and how the care is delivered.
Yeah, absolutely. So we are entirely remote, right? So everything is done either um, over video, like we are right now, or over the phone. Given the population that we work with, which Medicare beneficiaries, the vast majority of folks that we serve are not just over 65, but well over, right? That said, we do actually serve quite a few folks who are on Medicare disability, who we might have somebody who's 23 years old, and those folks do tend to be much more tech literate and on video or what have you. And so yeah, when I think platform, um, really, we have been able to build like the infrastructure and build the bones to not just do this on a local level or do this with a cap of a certain number of folks, but the idea is that we continue to kind of strengthen that, so that way we can really scale this to the point where folks all throughout the US need it, right? um, and so I think when I think platform, it is kind of like it is the back end, the technology that is going to enable this to scale to meet whatever the need is. Mhm.
And it sounds like it allows providers and advocates and advocators in one state can help. You're not limited to just folks in North Carolina providing the support. So I could call or log in and have support from someone in a totally different state, but that understand my health condition.
Absolutely, and I will say an important distinction is that when you're paired with an advocate, if you like that advocate, and I will say um, over 99 times out of 100, folks tend to stick with an advocate. Um, you keep working with that person, right? So it's not going to be, you call in, you explain what's going on over again, like you're calling a customer support line. Like these are individuals who really get to know you the same way that you wouldn't want to talk to a new therapist every week or something like that, right? That would kind of be counter to your treatment. Yeah, you will have the same advocate. Um, and yeah, an important piece there, right, is a lot of these advocates, the what's been built is really is based on the feedback that we've gotten from patient advocates over the years, right? And so it was really in response to advocates saying it's really hard for me to get my name out there. Me as like a small individual, having to handle like advertising and also this bookkeeping and also like all of these different disparate elements that as just like one person, I know a lot of us, have been in the same shoes, right? So uh, when speaking to kind of that point you're asking about earlier, platform, it is something that not only meets the needs of the individuals, but we're also seeking to meet the needs of folks who are seeking to be
Mhm.
advocates, right? On and be able to list themselves on a marketplace.
Mhm. Great
Mhm.
point. And I was just going to say, we've got a really thoughtful audience here. And I was going to say, questions are welcome. And I see we have one. Mary?
Yeah. Hey, Dylan. Thanks a lot for being with us. Good to see you. So do the advocates interact with the healthcare providers that the person has locally, like their
Absolutely.
doctor and things like that?
Yeah, no, great question. So as soon as an advocate uh, puts together a care plan, and that care plan is agreed upon by the individual or family caregiver, as well as the supervising physician. From there, uh, yeah, it's going to involve reaching out to the care team. One of the core things that our advocates can assist with is care coordination, ensuring doctors are on the same page, ensuring that their client feels heard by their care team. If they need to seek out a second opinion, right? Whatever it is, like if it is something that is within that individual's healthcare journey, it's absolutely something an advocate can help with. So really core to that, yeah, is working directly with the care team.
Can I have
Well,
a
I was,
follow-up
oh, good. I had a
question?
follow up too. So good, Mary. Ask your follow up. It might be the same one I have.
Yeah. So, a lot of times when people have, you know, devastating diagnosis, things just kind of go haywire, like trying to keep up with all your medical bills and being able to make sense out of your estimation of benefits and stuff like that. Would the advocate help them to do non-medical things like, say, find somebody that can help them coordinate some of these things that are just have to be done, but that people may not have the stamina or the wherewithal to do it?
Yeah, really excellent question. And I will say, like, one of the things that I'm really proud of, with regards to kind of the ongoing trainings that we're doing with advocates, is really like this policy of no homework, right? And what that means is if somebody comes to us, like goes to their advocate and says, "Hey, I'm having difficulty with this prior authorization or disputing a bill, or I need help, filling out the appropriate paperwork to apply for Medicaid." While those things might not necessarily be, clinical in nature, they are related to healthcare for sure, right? And so all of that is stuff that is within the realm of an advocate helping. Even if it's related to things like social determinants of health. We had one case, and I mean, we work with a really broad range, so it could be somebody who's like, I'm really not satisfied with my primary care, and I live in a small town. What am I going to do? Right? Like, I can't find anybody nearby. Or it could be the other end of the spectrum, which is, we had one individual who reached out to us who, in their intake call, we found she was diagnosed with stage 3 ovarian cancer the day prior, and she was also living in her car with her dog, right? And that that certainly goes beyond kind of the standard, what you'd think of as a clinical need, right? Even though there are a lot of clinical needs there, not only were we able to help that individual get an appointment with a specialist a lot sooner, because a 4.5 month wait is not guaranteed, of course, when you have stage 3 cancer. But also, the advocate was able to prioritize getting secure housing as well, right? And so, yeah, long way of saying we do handle far beyond just kind of like what you'd think of as core medical concern.
And the follow-up that I had to Mary's question was, are the care providers, the home providers for your clients and patients, are they receptive? Is there ever like pushback, like who's this outside person you've brought in? I know I can hear with other advocates, and maybe because your folks are clinicians themselves, but I've heard from other folks that sometimes, I mean, I'm sure HIPAA, all these forms are filled out that allow for the sharing of information, but is there ever pushback, like, hey, who are you, questioning what's happening?
Honestly, not really to my knowledge. That's not really.
Oh, good. I'm glad that you have to think about it. That's great answer. Good. So people can bring in their own advocates and navigators, and that's been welcomed. Or
I think the only pushback I have ever seen is and this is few and far between, right? But I mean, certain offices who might say, hey, like, we handle all of the holistic concerns of our of our patients, and meanwhile, the reason why they're reaching out to us is because they feel like their concerns aren't being met, right? And so that of course requires a lot of tact in approaching, and I feel like our advocates are very tactful in saying, like, hey, this is not against you, this is for them, right?
Mhm.
And also, we think it can be really helpful to them as well, right? So 87% of the clinicians that we surveyed said that since their patient has begun working with an advocate, that it's easier for them now. And this was a survey of primary care doctors of the individuals that we serve, right? So the vast majority really see the value here.
It's easier for the providers, or it's easier for the patients?
Actually, that they feel
Oh.
it's easier. That's based on easier for the provider. As far as our patients, and actually I misspoke, that was 88%. It's 97% of our patients reported that they feel more confident and overall more positive about navigating
Wow.
health with an advocate.
Uh, Great. Mary Lou, I see you have a question. Go.
I do. So first of all, I want to make sure everybody sees that Heather very graciously put your website in the chat. And so if you click on that, you can bookmark it, which I just did. And to somewhat answer your question, Heather, the patient themselves is who asks for an advocate. And so because
Yes.
they're asking for it, then I can't imagine they'd be saying, who are you now as part of my care? Because they asked for it. That I found very interesting. The person makes their own request to the website is very nicely done to walk the client through how do they get some more help. When I look at, nobody's saying not recording, I'm looking for a job, but in looking at the careers part, it looks a little limited as to what different resources you're looking for. And so I'm going to ask you 3 parts. It looks a little limited. The second thing is, how do those people then get paid? And does it all go through the provider? I just am curious about how does that actual system work?
Yeah. So can I ask a clarifying question really quick? Is when you said looks a little limited in what regard? Just in terms of the roles that we're hiring for right
Yeah,
now?
nurses and doctors is all it looks like. So in this group, this small group you have here, there's people who would be considered advocates in a variety of different areas that may not yet have been thought about by the agency, death doulas and community educators and all those kinds of things. So just curious.
Yeah, so we definitely go through periods of time where we are much more expansive in terms of like who we're taking applications from. I will say every time we put up and open up a call for applications, it's probably down temporarily right now simply because we get hundreds and hundreds of applicants when we have kind of our more general advocate roles posted, and we do have quite a few advocates in our network right now. Well over I believe well over 200, and I need to look at the most current number there. And as far as hiring on for physicians, we do need more supervising and intake physicians. So that's why in particular, that's a role that we have up right now. And we have been seeking out specifically nurses kind of to help cater toward different unique needs where we're looking for advocates who are more direct hands-on clinical. We have a pretty strong representation of such advocates already, but we also index I mean, I suppose equally, maybe slightly more on folks who have a case management background, LCSW hospital administrator, that sort of thing, right? So I think right now, just the postings that you see are kind of in response to that. I have no doubt in my mind, though, we will be opening that back up to a much broader range in the very near future. And on top of that, we even if it's not listed right now, we still do encourage folks to send over send over resumes, send them to me, right? If folks kind of within this network think that they may be a fit, we absolutely do still review those even if the posting isn't live. And other parts to that question, I'm not sure if I covered everything.
I was waiting. Oh,
So then does the payment go through the provider or directly to the person? I'm just curious. I mean, it looks all awesome. I'm just
Oh yeah, absolutely. Sorry, I just forgot that piece. So yes, as far as the way in which folks are paid, at the moment, everything is essentially billed through our staff physicians, and then we pay out to our advocates. Yeah. So yes, it is billed to insurance through the credentialed provider.
mhm. All right, I was seeing if there was any follow, but I was looking up real quickly, Dylan. I'll put your email address out there. And it seems to me, and I know we started a little late, so we're going just just 2 minutes more if you don't mind. I would think also bringing in your providers, your advocates, your navigators. I use different terms. It's advocates, right? Or advisors? What's the term for your people?
So it is advocate. I prefer to say it. I know it's like a mouthful, but I prefer to say independent patient advocate. And the reason being is because the alphabet soup, and I mean, we're all incredibly familiar with this, right? But the use of a term to the point where it then becomes void of meaning, right? Putting natural flavors on something, right? Or
Yes.
something like that, right? So, when you call a hospital system or when you call an insurance company, they might say to you, hey, this is your advocate. And it's like, are you my advocate or are you the system's advocate, right? And so that's why I really like to say independent patient advocate, because our folks are not going to steer you to any one preferred system, try to get somebody on a, a specific health plan or whatever it is. There's no stake in it for them other than doing what's best for that individual patient.
And that's great. And I think also it clarifies my earlier question, which is, yes, so the patient reaches out, asks for an advocate, and this is an independent patient advocate that then will link to that patient's provider and health system. And so, wondering, and then they bill separately. So it's different from, so we have folks here from ECU Health. I could, if I was a patient of ECU Health, I could hire someone from Solace or if I was on Medicare, use my benefits, have an independent patient advocate, and they would help me ask some of the questions or navigate what was happening with my work at ECU Health or work with my folks at ECU Health. Does that sound right?
Absolutely. Yes. Okay. Yeah. Whatever your system is, like there will be no, if somebody wants to find, a new care team, sure. But the vast majority of the time we work with their existing care team, to just kind of help everything go smoother. Yeah.
So then I think my last question, because as we start to go, is that part of, as you talk about scaling up and adding new advocates, I would think it would be correlated to how many actual users you have. And I know you're head of outreach. And so, how many people do you have, or just how that link is. So I would think as you start to scale up, you'll need more providers, but how is it going? And how do you go direct to consumers? How do you find your participants, clients, patients?
A great question. Yeah. So we do have, we've served well over 10,000 individuals at this point.
Wow.
And the vast majority of what Solace does is kind of direct to consumer, if you will, digital advertising at present. We are looking to broaden that because, of course, only, a subset of Medicare beneficiaries are actually, going to be looking at a ton of digital advertising at any given time, right? So certainly broadening that. The outreach program that I'm running here in North Carolina is the only in-person, like face-to-face stuff that we are doing thus far. And this is really to really prove out that there is a benefit of being out in the community, talking to people, making connections with, senior centers, rehabs, going to health fairs. So both, connecting with healthcare professionals as well as getting directly in front of individuals, who wouldn't otherwise see us. And so, that includes things like, popping up at an assisted living or going to, public housing in Durham, right? So there's a pretty broad range of the things that we're doing. We are seeking to do significantly more stuff where we're getting directly in front of individuals, because I will say, you end up getting folks who are definitely underrepresented online when we do the things that we do in person. For example, the outreach that we're doing in the Triad, I would say easily well over 2/3 of the folks who we've connected with advocates are people of color. The majority are women. And that, is not, when we don't take demographics of clients or patients online, but based on trends online, it's safe to say that looks significantly different from users that you just find online, right? So we're always looking for, opportunities to be able to get out to, speak to folks about what we do and, to help get them connected with somebody who can help.
And the great benefit, and as I understand it, for folks that have qualifying Medicare and Medicare Advantage plans, it is no cost to patients because it's covered under the diagnostic code. So, right, there's no outpatient cost for the client. It's so this is a covered benefit that you have figured out how to use the codes, right? So that's what's exciting about the outreach, if I understand that correctly.
Absolutely. Yes. Yeah. I mean, it is very rare to be able to go out and talk to people about something that they definitely need and they also don't have to pay anything for. So I personally really love that. Yeah, it's yeah, so it is something that folks can access without incurring any cost.
All right. Well, I realize we've kept you late, and all right, you have 30 seconds, I guess, or take the minute. You have a whole other job, the side love of yours. Just mention it really quickly because how that through line happened. Um, I'd
Well,
love to share with others what your other job is, even though I've told them beforehand.
so I do have a little shop in Saxbaha called Two Damn Goods because we have two dams in Saxbaha, and we do secondhand as well as some original art, some local curations and fun stuff. So we have a pretty big holiday market coming up in Saxbaha in a couple weeks. So it's a great time to come visit town. It's a cute place.
Well, I see, even though your clothes are wonderful, I'm trying to do a through line between your work with Imperfect Food and Misfits, just finding gems and bring it to people, like this awesome shirt that I bought there, that you find this great sort of vintage and resale. And I do think that that's part of a whole other environmental, I don't know if justice is the right word, but finding cool things and sharing it with others as opposed to creating more. I don't know. All right. So there was another.
Oh, did I freeze? Did
Yeah, it froze for just a second, but so one other final question back to Solace. We keep saying one other final question. Caregivers.
okay.
Could I call on behalf of my father? How would that work? Or it needs to be billed through his Medicare, but how does that work?
It does need to be billed through their Medicare. However, if you have permission, you know, the caregiver for half of the folks that we work with is the individual that we talk to. The like the end user, the client, needs to be on the intake call, but thereafter everything can be done, you know, directly with the caregiver.
Mhm. And if I'm not mistaken, when you and I got together a few months ago, I think I sent Karen the information on the Medicare billing codes for family caregiver training. I think I sent that to Dylan so that way they can make use of all the codes with their support. All right. There's a lot more. Dylan, I am so glad you joined the North Carolina Serious Illness Coalition. And I'm so glad that you joined Friday Facts. Dylan's not going anywhere. He's going to participate more. And everyone, he just put, for those who are watching live, you just put your email and your phone number, and we have the website. But Dylan, can't thank you enough for our second to last Friday Facts of the year and for all that you do to support communities throughout North Carolina and also throughout the nation, because you're a nationwide group.
Thank you. It was a pleasure. I really appreciate it.